Return demonstration.
Hello, hi, good morning. I'm Cheska Serondo, BS-N1C, currently studying at North Valley College, taking up Bachelor of Science in Nursing. So for today's video, I'm going to do the return demonstration. The process would be the data collection, which include the health history, the past and present history, the family history, the lifestyle following the cold spa, subjective data versus objective data, method of data collection, interview, observation, physical assessment, documentation of data. I will also include the vital signs. So, checking the vital signs, which includes the body temperature, respiratory rate, pulse rate, the cardiac rate or the apical pulse, and also checking the blood pressure, or also known as BP, and also the height and weight of the patient. So, to avoid rush, the materials needed in the procedure must be present in the procedure.
Before doing any procedure, make sure that hand washing is observed. Materials needed: wristwatch, jot down notebook and ball pen, sphygmomanometer and stethoscope, cotton balls, trace, rubbing alcohol, and thermometer.
Hello ma'am, good morning. I'm Cheska Serondo, your student nurse, and you are?
Good morning, ma'am. My name is Hannah Mia Pari.
So how do you like me to call you, ma'am?
You can call me Hannah, ma'am.
So, I have to clarify some of your personal information here, ma'am. You are Hannah Mia Pari, right? 18 years old. In your address, ma'am?
San Vicente, Maclala North, Cotabato, ma'am.
And you are single, right?
Yes, ma'am.
Okay, so before getting any further, I like to let you know that in order for me to help you, ma'am, I have to ask some question regarding on your health, your medical backgrounds, and also your personal circumstances. So your answer will be documented so that we can formulate the best care that suits your need, ma'am. So do you have any questions?
None, ma'am.
Okay, let's get started. So what brings you here in the hospital, Miss Hannah?
I came here, ma'am, because I experienced a lot of rashes.
A lot of rashes. Okay. So, can you describe it, ma'am?
It kinds of red patches, and it looks like acne, ma'am.
So, when did it begin?
It begins, ma'am, when me and my friends having a vacation in a resort.
Okay. So, where is it? Does it radiate or occur everyone else? So,
here in my
Elbow?
elbow,
Okay.
ma'am, and also my back.
in your back. So,
Yes, ma'am.
how long does it last?
It's
It's
been
been
2 weeks, ma'am.
2 weeks. Okay. So, how bad it is? So, from 0 become the lowest and 10 become the highest. Can you rate your experience rashes, ma'am?
I think, ma'am, 8.
8.
Yes,
Okay.
ma'am.
So, what makes it better or worse?
When I'm going to sleep, ma'am, because it takes a lot.
So, what other symptoms that occur and what it affects you, ma'am?
It affects me a lot, ma'am, because especially when I'm going to sleep, because
So,
it
your
bothers me
feels
so much.
it bothers you?
Yes, ma'am.
Okay, ma'am. So, that's end our old spa or interview. So, morning again, ma'am. I'm Cheska, your student nurse, and today I'm going to have a general survey about your body. So, it's okay with you, ma'am? Okay. First,
Checking the scalp, the formation of the face, the ears, the eyes, the nose, the back, the shoulder.
do like this.
While talking to the patient,
Then around
her
the
airway is good. Checking the back of the patient. I can see that her breathing is normal. There's no respiratory distress. When I touch the patient's skin, I feel the warm
so
and
much,
dry. The circulation is intact.
Hello, ma'am. Next is checking your vital signs, which include the body temperature, the respiration, the cardiac rate, the BP, and also the pulse rate.
Cleaning the thermometer using cotton balls. Measuring body temperature.
So next ma'am, while waiting for the thermometer to beep, I will check your pulse rate.
Have the patient rest her arm alongside of her body. Place your first, second, and third finger along the radial artery. Press gently against the radius. Rest the thumb on the back of the patient's wrist. Count the number of pulsation felt for 1 full minute. Then record the
Next
result.
is your respiratory rate. So
While the fingertips are still in the place after counting the pulse rate, observe the patient's respiration. Note the rise and fall of patient's chest with each inspiration and expiration. Using a watch with second hand, count the number of respiration for 1 full minute. Record the respiration rate on the jot-down notebook.
okay, your respiration, then your thermometer.
While doing the respiration, the thermometer beep and record the result. Then cleanse the thermometer using the cotton balls with alcohol.
Next, your cardiac or your abdominal pulse.
Place the diaphragm of the stethoscope over the apex of the heart, located to the fifth intercostal space. Move the diaphragm to the side of the loudest count of the beats for 60 seconds and note the rhythm and volume. Then cleanse the airpiece and the diaphragm of stethoscope using alcohol swab. Lastly, measuring the blood pressure. Then record the result.
So that's the end of checking your vital signs, Ma'am Hannah. So thank you so much and have a great day, ma'am.
Thank you rin po.
Name of the patient, Hanami Apari, 18 years old, San Vicente, Maquilala, North Cotabato, single. Chief complaint, the client reports red rashes on her arm, elbow, and her back. Vital signs, body temperature, 35.4 degrees Celsius, pulse rate, 83, respiration rate, 16, cardiac rate, 16, blood pressure, 120/70, height, 5'4", weight, 52 kilogram.